And last week in Your Community Health with Arnett Health, we talked about different types of pain, including chronic pain. This week, WENY's Renata Steele continues her conversation with Dr. Sarah Nasir about chronic pain and different types of pain management options.
Hello and welcome to this week's edition of Your Community Health. I'm Renata Steele with WENY-TV, and I'm here with Dr. Sarah Nasir, who is a second-year resident here in family medicine at Arnett Medical Center. And we are continuing our conversation this week about pain. Last week, we talked about different types of pain, touching on pain from getting hurt. You mentioned stepping on a Lego or getting burned, but we also touched on chronic pain. This week we're going to talk a little bit about pain management. And Dr. Nasir, we talked about different types of chronic pain and what could contribute to that. What are some of the different methods for treating chronic pain?
So, Renata, with chronic pain, definitely a lot of times we do turn to medicines to address the acute pain level when you just start off with it. Something triggered it, so you want to address that. So while we were talking about low back pain, we continue talking, I'll use that example. So with my patients, when they come talking about low back pain and it's a new patient with that diagnosis, a lot of times we rule out things like, is there a herniated disc or not? We look into imagings, and if that has been ruled out, that there is nothing that needs surgical intervention, that's an emergency, we next move to see if it's musculoskeletal, which a lot of times it is. Then I advise my patients to use conservative measures. Ibuprofen is great for inflammatory pain that generally musculoskeletal pain tends to be, like ibuprofen. And sometimes I alternate it with Tylenol just for the pain management. And if it is muscle spasm, we give spasm relief medicines, and moist heat, ice application. I like to refer my patients to physical therapy to strengthen the muscles. As I mentioned last time, our muscles are what are keeping us straight and preventing us from flopping over with all the extra mass in the front. So they work very hard. So if they're deconditioned, that's when they start complaining to your brain, hey, we're in pain, do something about this. So physical therapy for help with conditioning. And then I like to talk to my patients about addressing other mental health or anything that's causing mental problems like stress. Lowers your pain threshold. Not getting enough sleep, that lowers your pain threshold. A lot of times depression is very big and people don't like talking about it, unfortunately, but it really lowers your pain threshold. Things that I do for myself and my family members, and a lot of people do it, meditation, mindfulness, guided imagery, what else? Having hobbies, because that relieves stress. If there's something that's causing stress in your life specifically, focus on that. So these are a lot of ways to deal with it. And when things become more accelerated, that's when we refer to pain management for any further intervention. But I really try to stay away from narcotic use if I can.
Yeah, so let's touch on that really quickly, the use of narcotics or prescription opioids to deal with pain, because those are highly addictive medicines, and we're seeing a lot of that in our community.
Yes, and it is unfortunately, and I would say, an epidemic in the Elmira, Chemung County area. We have a lot of specialties coming together to help address that, and hopefully it's something we can address in the next few months and control it better. So with any pain medicine, it doesn't even have to be narcotics. The more you use it, the more your body regulates how much receptor there is in the brain for the medicines to attach to and reduce your pain perception. So with narcotics, unfortunately, there's also a potential to become dependent on it mentally. So to get that high next level, a lot of people end up getting addicted to it. So that's one of the reasons why I try to avoid it, and I try to advocate not using pain medicines as much, but trying to address the underlying problem of the pain.
All right, well, those are all really good points that you talked about: lifestyle changes, overall well-being, different things that people can do to enable themselves and work with their physician to help manage their pain levels and seek the appropriate treatment. So Dr. Nasir, thank you so much for talking with us about this important topic, and we're going to have more information and more resources for you to check out on our website at WENY.com. Thank you so much for joining us for this week's edition of Your Community Health.